Next, we have Dr. Praveena Shyam, who will be presenting on botulinum toxin in acquired Comitant Esotropia, a retrospective interventional study.
Good afternoon, everyone. I'm going to present my study on the role of botulinum toxin A in acute acquired or comitant esotropia. As you all know, acute esotropia is characterized by rapid and unexpected onset, often leaving individuals with double vision, discomfort, and profound visual disturbances. And its potential for serious visual impairment definitely demands a thorough understanding of its etiology and optimal treatment strategies. There are mainly three types of acute onset esotropia reported in literature: the Swan type, the Bruin-Franciscetti type, and the Belshowski type. But literature also supports a recent increase in the incidence of acute esotropia among children and young adults with the onset of COVID-19 pandemic. This could be probably due to the rapid and profound shift in their lifestyles across the globe, leading to an exponential growth in gadget use, prolonged screen time, and excessive near work. Even though we have a variety of treatment modalities available, surgery always remains a mainstay of treatment. But the eating prism phenomenon makes it difficult to titrate the accurate surgical values. In such a situation, the Botox has revolutionized the treatment of acute esotropia with satisfactory outcomes in a short time. So we decided to study the effect of botulinum toxin A in the treatment of acute onset esotropia among pediatric age group and young adults. It was a retrospective study between Jan 2020 and June 2023. We included all patients with sudden onset esotropia, binocular diplopia, with no evidence of incompetency or EOM limitation. All patients were aged less than 30 years and had an angle of deviation more than 16 prism diopters. Those with any organic eye disease, history of occlusion therapy, previous systemic and intracranial diseases were excluded from the study. MRI brain was done in all cases to rule out an intracranial pathology. Binocular visual function assessment was done on a routine OPD basis on the previous day of surgery, which included the squint evaluation, the sensory fusion, and stereopsis assessment. After administration of anesthesia, Botox A injection was injected into the muscle belly of medial rectus 5 to 10 millimeters behind the insertion point with a 27 gauge needle, and the doses were titrated based on the angle of deviation. Treatment success is defined as either orthotropia or an angle of deviation within 10 prism diopters. Recurrence is defined as a new onset diplopia or esotropia after 6 months of Botox therapy. Coming to results, we studied 27 patients with a mean age of presentation around 12 plus or minus 7 years, and we had equal number of participants in the pediatric as well as the young adult group. Majority presented with complaints of squinting as noticed by parents, and the most common gadget used was a smartphone. And 78% of our study subjects were emmetropes, and none of them had an uncorrected refractive error. The mean duration between the onset of symptoms in Botox ranged between 2 weeks to 28 weeks. Comparing the pre- and post-operative angle of deviation, we found a statistically significant drop in the angle of deviation throughout the follow-up visit, with maximum effect at 1 month post-injection. And these are the preoperative and postoperative pictures of a 4-year-old and 24-year-old who presented to us with esotropia post-Botox therapy having excellent ocular alignment. On comparing the different outcome measures, nearly 51.8% attained treatment success and also regained stereopsis at the final follow-up, and 66.7% attained good sensory fusion with complete alleviation of diplopia. 4 patients did not show any improvement. 3 developed recurrence, 2 after 1 year of Botox and 1 after 6 months. 11 patients eventually had to undergo extraocular muscle surgery to attain optimal ocular alignment. When we compare the effect of timing of Botox therapy on the outcome measures, we found that all who took the Botox within 3 months of onset of symptoms had excellent ocular alignment, BSV, and stereopsis when compared to those who took more than after 3 months. But the stereopsis results were not statistically significant. Coming to discussion, etiology of acute onset esotropia always remains a subject of debate and is often associated with sustained near-point demand, which can contribute to an imbalance between the accommodation and divergence mechanisms. And this could have caused the dynamic activation of medial recti muscles in our patients, consequently manifesting as esotropia, since none of our patients had uncorrected refractive error. And the primary objective is to alleviate troublesome diplopia, and Botox therapy stands out as an effective solution in that, as it reinstates the divergence ability of the patient. With this chemodenervation approach, we achieved a success rate more than 50%, enhancing the quality of life for our patients much more rapidly and earlier than a surgical intervention. Coming to residual ETs, even though Botox therapy reduced the horizontal deviations significantly to less than 20 prism diopters, we had a few cases of residual ETs which could be effectively managed through a prism therapy and divergence exercises, eliminating the need for surgery in this subset. And only 3 patients exhibited residual esotropia large angle more than 40 PD compared to a preoperative count of 17 patients, thereby obviating the need for excessive recession resection surgeries in these subsets. We had 3 patients with recurrence, and we believe that this could be linked to a residual implicit deviation and persistent excessive use of mobile phones, which shows the importance of adherence to post-treatment instructions, which can influence the success of Botox. And we also found that an administration within 3 months is effective, as prolonged misalignment can lead to muscle fibrosis, scarring, change in contractile properties of the muscle, and also reduce the neuroplasticity and hence affecting the neural rewiring and muscle adaptation. Comparison with other similar studies definitely show that Botox is a globally recognized treatment option, and we could achieve similar results with other treatment studies. To conclude, I would like to say that while the benefits of botulinum toxin therapy are apparent, the treatment should be assessed individually for each patient, and it is definitely a preferred choice for early postoperative visual rehabilitation, and Botox therapy can obviate the need for large angle horizontal muscle surgeries, especially when it is administered as early as possible. Thank you. These are my references.
Nice. So, did you have any complication in your series?
No, sir. Usually we expect ptosis, which is the most common complication with Botox, but none of our patients had any complication.